Hello and welcome back to GP Video Podcast by Nadia. So after so many days of not doing with GP Video Podcast because I don't know if you've been seeing my posts on Facebook or not, I've been a bit down with my health. My ferritin levels are very low. They're only 20. My TSH indicates that I might be hyperthyroid, but I have to investigate it more. Anyways, I just thought that, I have to gather myself and start doing everything. I was working nonstop, never took off, maybe 1 or 2 days. But then apart from that, I've been working nonstop. I have been trying to catch up with all my work because I love my patients, I love my work, and I cannot let them suffer just because I am a bit sick or something. Hopefully, I'll get an iron infusion this week and we'll investigate my thyroid as well. But in the meanwhile, I just wanted to make this short video podcast. This is about, okay, what's wrong with my... Okay, all right. I've just come back from work. It's a Sunday. I've just finished work at 5 and reached home at around 6:21 p.m. And just did my lipstick again for the video podcast, but I think I didn't do a good job as always. Anyways, so what I wanted to tell you quickly today is that for the first time in more than 30 years, the federal government, which means the Australian federal government, has a new subsidy for an endometriosis treatment, WISN. So basically, endometriosis, I've done a video podcast before on that. It is a condition which is a very painful condition in which what happens is the endometrial lining of the uterus, which is supposed to be in the uterus only, is also found in other places, like for example, in fallopian tubes, in ovaries, or in any other part which is surrounding the uterus, or it can actually go up sometimes to the chest as well. So this is a very painful condition. When one has the periods, it's very, very painful. Yes, there is a bit of bleeding disorder as well, but basically pain is the thing which is like really, really, really bothersome. So, and it's a very common condition as well. The treatment for this is a medication called Dienogest, which is a progestogen-only medication. So what progestogen does is progestogen actually does not let that endometrial tissue to grow and stops it from growing, and thus it actually helps with the pain and with the condition. So for the first time in more than 30 years now, this used to be an expensive medication, but now it's on PBS. So when you visit your doctor, please ask for it. Its actual name is Dienogest, but the brand name is WISN, WISANNE, and it is to be taken. It is a progestogen only pill. It is to be taken every day, and it helps really a lot with the condition called endometriosis. Now, the only problem with this medication that I've found is, and I don't have an answer yet, but so far that I have looked up, I might have to contact a gynecologist and ask the answer for this question, is that it does not work as contraceptive pill. So we do have progestogen only pills like Slinda, like Microlet, which are very good contraceptive pills. But this one, as far as I have researched, it is not a contraceptive pill. And the issue is that if you are on this medication for the treatment of endometriosis, you cannot go on another hormonal pill for contraception. So the contraception methods can then only be non-hormonal. I might be wrong in both these statements, but the first statement that I made, that it is now on PBS and it's cheap and it's a very, very good and effective medication for endometriosis treatment, that is absolutely true. But the other two statements that I've just made, which is one is it does not work as for contraception, unlike the other progestogen only pills which are there for contraception in the market. Plus, what was the other one that I said? Yes, the other one that I said was that when you are on WISN or Dienogest, you cannot go on another hormonal tablet or IUD or anything like the hormonal IUD. I might be wrong. You could have maybe Mirena in with it. Mirena also is inserted in the uterus and it only releases progesterone. You can have copper IUD because copper IUD is not a hormonal one. But these two statements, I really need to make sure that I'm giving you correct information or not. But yes, it is a very effective treatment if you have very, very extremely painful periods, irregular menstrual bleeding, and you are diagnosed with endometriosis, then this is the treatment, Wisin, which is Dynogest. The medical treatment, there are surgical treatments as well, but the medical treatment is Dynogest, which is progestogen only pill, and its market name is Wisin, and it's now on PBS. So please ask your GP, they are able to prescribe this medication. And yeah, but I would also make sure that whether it is used for contraception, or if it's not, then while you are on it, can you do another hormonal method for contraception along with it simultaneously? So I will get back to you with those answers, and hopefully I will try and make one video podcast every day. And keep well, everyone.